a new state law to protect infants, a deep dive into your healthcare needs, and what's for breakfast. This is Carolina's Healthcare System Network News. North Carolina has a new state law to protect newborns from a life-threatening disease. It's called Severe Combined Immunodeficiency, or SCID, and it basically eliminates a child's immune system, putting it at risk for developing all sorts of deadly infections. Every newborn in the state now will be tested for this disease, potentially saving thousands of lives.
Babies who are born with SCID appear normal at birth, but typically die in the first year or two of life. About 1 in 40,000 to 1 in 50,000 live births, and that may seem like a small number, but if a child is born and that goes undetected, that child will be affected and could potentially die.
SCID is most often treated with a bone marrow transplant. Healthy stem cells are injected into the newborn to stimulate new bone marrow growth. So, a bone marrow donor has to be found.
One of the processes we start with is to look to see if there are any well-matched family members. We also utilize the National Bone Marrow Registry to go outside of the family if needed. We actually have ways in which we can do bone marrow transplants here at Living Children's Hospital, which are kind of unique and special insofar as we can use half-matched family members sometimes to serve as donors. And that's one way we identify that almost every patient can have a donor.
And the best news?
There is a cure for that condition, and the cure is here locally.
Patients who are able to successfully undergo bone marrow transplant can live long and healthy lives.
And the takeaway for parents?
The treatment and therapies for severe combined immune deficiency are available here at Living Children's. We've been doing transplant for bone marrow and stem cells for a long time. We're very experienced and we have very successful outcomes.
This is the last installment of our occasional look at big data in healthcare and how Carolina's healthcare system is working on more efficient and effective ways to keep you healthy. We explore the concept of segmentation. Segmentation is looking at the population and breaking it into smaller groups based on common needs or desires for a set of goods or services, such as who needs diabetic or heart disease care.
I think of segmentation as kind of a water well, in the sense that various groups and users can come together to this well to get information. There are going to be some groups that want to use the water to make a cup of coffee. Others are going to want to feed their crops or things like that. And what segmentation is, in general, is it's a way for us to sharpen the questions asked. So our patient population is living and breathing. It's constantly changing, and so we can actually use these segmentations to monitor their progress. So they came out to 7 patient segments. We have a high-risk category, aging and rising risk. Low risk, people have come into the system but they haven't interacted in roughly 18-month periods. We just don't know a lot about them. And then we have newborns and toddlers is another low-risk segmentation. And these are, how do we get them into the system? We have complex chronics, and these people have a lot of things going on. They might have diabetes, they might even have cancer.
By breaking the population into segments, a comprehensive profile of the patients can be developed. That includes clinical data, like illnesses and diseases they may have now, make predictions about what illnesses they may get in the future, where they live, and what healthcare services are available or should be made available to them.
Now we have amassed a big collection of data about patients, and we can use that data in ways that have never been possible before in terms of getting the care for these patients.
The future of using big data in healthcare is now. It's important work toward helping you stay healthy by getting you the care you need when and where and how often you need it. Eating breakfast has finally become a trend, and food companies are boosting sales in several breakfast food categories. Consumers want it to be portable, high protein, and of course, taste great. Here are some of those trends. The number 1 ranked breakfast category food is dry cereals, followed by egg substitutes and real eggs. Breakfast is the fastest growing meal purchased at restaurants. 63% of consumers might grab something from home to eat on the go, while 45% will go through a drive-through restaurant, and 31% will stop at a convenience store or gas station. 93% of us say we consume ready-to-eat cold cereal. Only 21% of us skip breakfast when we're running late in the morning. And women consume 65% of the yogurt in the U.S. And the moral to this tale is, whatever you do, don't forget to eat breakfast. Dare we say, it's the most important meal of the day.